Hello, my name's Mrs. Akhtar. I'm the main teacher of health and social care, and I'm just going to be going through what you'll expect to see on the course if you chose it as an option. I think when you pick a course, it's really important to look at the assessment criteria. Some people aren't good when it comes to learning information and then giving a set of questions and answering a question. Some people prefer more practical courses. So in health and social care, 60% of the course is in-class controlled assessment tasks. So it's set over 6 hours. So you'll be given a booklet with questions set by the exam board, and you'll get 6 hours to answer it. It won't be 6 hours in like a block booking, it'll be six health and social care lessons. You'll have your laptop with internet access, you'll have the textbooks, your exercise book with all the knowledge that you've learned. So you will have resources to help you answer the questions, but you won't be allowed any teacher help. So it's about reading the question yourself and figuring out where to get that information from. Then the remainder of the course, the 40%, is a 2 hour exam which is sit at the end of year 11, and that will be in the main hall under exam conditions. It'll be maybe two case studies, and you'll have to answer questions based on the information that they give you in the case study and use knowledge that you've learned in class in order to come up with a plan for that person. Like I mentioned before, the exam board is Pearson. If you want any more information, then a quick search on Google. If you type in BTEC Health and Social Care, it's normally the first link and it takes you to the Pearson website. On there, there's a exam specification and there's just more general information. So in health and social care, there's a variety of topics that we cover. So you look at being a baby and the kind of milestones that you'll hit in infancy, to being a toddler, to being a young child, to adolescence, to being an older person, and then eventually old age. You'll learn about stress and anxiety and different methods to help you cope with stress and anxiety. You'll learn about illness and disease and how it affects you and those around you. You'll learn about diet and lifestyle choices, for example, the Eat Well guide, what the government's recommendations are for you in terms of diet to be healthy. You'll learn about religion and culture, how that influences people and how it gives people guidelines in order to live like a better life. You'll learn about relationship changes. You'll learn about different types of support. Say if you've had an accident, for example, what support's available for you. For example, informal support like family and friends, formal support such as doctors. If you're struggling with your mobility, you could get the help of a physiotherapist, for example. You'll learn about different health conditions, so asthma, diabetes, blood pressure, COPD, and how people get these diseases, whether it's inherited or it's because of the lifestyle, and what things they can do. For example, change the diet, change the lifestyle in order to reverse things like potentially type 2 diabetes. You'll learn about what help there is for the elderly, vulnerable children, and people with disabilities. And you'll learn about housing and home environment, so where we live, the location, and what happens in people's homes, how it affects them physically, intellectually, emotionally, and socially. So that's just some of the topics that you'll cover. So for health and social care, there's loads of skills that you'll need and you'll just genuinely have. I think one of them, what most people will possess, would be empathy. Just being able to put yourself in someone else's shoes. You'll be learning about sensitive issues such as death, divorce, discrimination, amongst many other things. So being emotionally resilient is a really good quality to have. Good timekeeping skills is excellent to have, because you'll be given, like I said at the start of this presentation, 6 hours to complete the in-class assessment. So being able to manage your time and saying for each task, for example, 2 hours on task 1, 2 hours on task 2, then 2 on task 3, being able to manage that into small chunks will be a valuable asset. Good organisational skills, again, being able to multitask between the different tasks. The ability to understand information and respond using knowledge that you've learned. Like I said before, the teacher's not allowed to help you in the in-class assessments. So it's a case of you sitting there with the question at hand and trying to break it down yourself. And then finally, you being able to reflect on feedback. So throughout the course, you'll be given progress checkers 2 every half term. So I'll give you a question and then you'll have to respond. And it's just about taking the teacher feedback on board and then using that in your actual assessment. Health and social care, it's a really good course to have under your belt. It can lead to a variety of different careers. For example, social worker, counsellor, occupational therapist, health visitor, care worker, health psychologist, teacher, nurse, doctor, ambulance worker. The list is endless. It really is. And on the next few slides, there's information on some of these career paths. But I would always direct you to careers websites online if you want more further information. But it's just one of those courses with an endless pathway. So health and social care can lead to a variety of career paths. One of them, occupational therapist. An occupational therapist, also known as an OT, they help people whose health prevents them from doing different activities. So it could be getting dressed or running errands for them. Some of the skills include being good at solving problems, working with others, and having good IT skills to keep careful records and looking at sensitive information. To become an occupational therapy, you will need a degree for it, and it needs to be approved by the Professions Council. Work experience is an excellent thing to do to show that you've taken on a caring role, and that will definitely help you with your university application. Another role is the role of a care worker. Care workers help people live more independently, and they might help them with social activities, physical activities, either booking appointments, even personal care such as helping them shower and getting them dressed. You can work in a variety of settings, whether it's going to the patient's house or working in a care home with them. It is an emotionally and physical demanding job, it really is, because you're going to see people that throughout all their life they've probably been so independent and they've done everything for themselves, and then when it comes to old age or illness or disease, they have to rely on someone else. So empathy is a massive thing that you'll need, and it can be draining. You need to be able to manage your time, use your own initiative, and just have a really good person-centered approach and put the person that you're caring for at the center of everything that you do. You don't need any qualifications to become a care worker. Some employers might ask for like GCSEs in English and maths, but work experience is an excellent thing to do, and there's lots of agencies out there that you could sign up to in order to get a feel of if this is a career for you. So you can become a counsellor with health and social care. Counsellors help patients work through difficult times in their life. For example, if they've lost someone, so if they're going through a bereavement, a death, it can help someone come to terms with a long-term disability, if they've gone into a different relationship, for example. And the whole role of a counsellor is just to make people feel good and introduce positive changes to their life. There's a lot of skills that you need, but I think priority is just having empathy again, which is the theme for most of these careers, and just being able to put people at ease and having excellent listening skills. So to become a counsellor, it is quite a long process. You do need a degree for it, and there's a specific training route. So there's also a health psychologist. Their role is to improve people's awareness and attitudes towards health. They'll make positive changes in their patient's life in terms of how they think and the behaviour. For example, if somebody has too much alcohol because of their lifestyle, or doesn't eat as healthy as they should, it's about making them have better informed choices about changing these lifestyle habits. Some of the skills you need is strong critical thinking skills and being able to research things in order to come up with a plan for the patient, the person that you're working with. Again, it's a degree profession, so you'll need qualifications in health psychology and then further training. A lot of people that choose health and social care, they go on to become a social worker, and the whole role of a social worker is just providing better options for people. So the aim is to help people, help families to live a happier, more fulfilling life, encourage people to live independently and protect them from harm or abuse. So you could be working with children, or you can choose to specialise with elderly or disabled people. And the whole point is to support them on an individual basis and direct them to services that they might need, and just protect them from the harms in the world. Some of the skills are problem solving skills, because you have to figure out situations and solutions for people dependent on their personal circumstances, whatever they're going through. You have to advise people and figure out what help they need. Social workers also need to be able to work well in a team. Some of the qualifications that you need, definitely it is a degree profession, so you'll need to complete a 3-year degree, and that'll need to be approved by the Health and Care Professions Council. Here are some comments from current students that are doing the course. So Molly said that she can relate to health and social care as it helps her learn more about her brother's illness. He had autism, so it helps her learn more about the condition that he's got and what he can do to overcome the barriers that he might face. Akib, he says he really enjoys health and social care and looks forward to his lessons. And I think when picking an option, you've really got to think about if you're going to enjoy it, because if you enjoy it, you're going to do well in it and you're going to want to come to it. And finally, Inaya said health and social care is challenging but also very interesting. I think on that note, I'd definitely say that health and social care, it is a challenging course, but it's really interesting at the same time. There's lots that you're going to cover and it'll help you in the outside world. And the skills that you get from health and social care, you can transfer them to any course and anything that you do as you get into your career path. So it's a really good course to have, and Molly, Akib and Anaya are testament to that. So I hope this presentation has been clear and concise and you've got the main information that you need. If there is any more questions that you've got, I'm more than happy to answer anything. I've popped my email down below, and my room is F8. So my email is m.akhtar@waterheadacademy.co.uk. That's again for students or parents if you need any further information. Overall, thank you for taking the time to learn more about the course, and all the best with your options.